everyone, it's Dr. Lachman from Cool Dental. Been doing implants since 1996, and you learn a lot of things over the years as technology improves, techniques get better, faster, more predictable, and less expensive. So let's just show you how we used to do things in the old days, okay? Basically, someone had to get their teeth removed. This is a patient of ours. We saw her easily 20 years ago. She lost her teeth due to large cavities and gum disease. We put the implants in. You can see there's 2 implants here connected with a bar. 2 implants here connected with a bar. 2 implants here connected with the bar. Patients always say, "Doc, those look like screws." Well, they're not screws. I don't buy them at Home Depot, but the idea is the same. These are what we call root form implants, and they work very, very well, very predictable. It's kind of the standard of care for many, many patients. The only reason we don't do this anymore is because it takes a lot of appointments, it takes a lot of time, and there's a lot of expense in doing this, which makes the procedure out of reach of many people. So let's explain how we used to do it so you can learn and appreciate how we do it now. This is looking inside the lady's mouth. Here's her tongue. Here's 1 bar connecting 2 implants, another bar, and a 3rd bar. So basically she has a support structure through her whole lower jaw. And you can see here her denture has little metal clips that connect to the bars. We actually had to remove this clip and loosen these clips because the denture was too snug. Imagine that, someone with a lower denture that's so snug, she's having a hard time taking it out to clean. So we had to loosen it for her. This procedure works excellent. We got hundreds of patients going through life like this, and they're very, very happy. If you have something like this, great. Don't have to replace it. Just enjoy it and know that people going through the procedures now, it's done quicker, it's done in a day, and we don't have to have removable teeth. Okay, so the only downside of doing this, you have to extract the teeth. Sometimes you have to wait for the bone grafts, so there's an extra expense and sometimes 4 to 6 months for the healing of that to be done. Then you got to start to put the implants in. That takes another 6 months, so now we're already up to 8 months or maybe almost a year. Then you got to start making the bars. And the bars take a few appointments. And there's a large expense in making these bars. Those are custom made bars for each individual patient. And so by the time you get the denture made, you're looking at an expense well in excess of almost $40,000. And you still have removable teeth. And it takes at least a year sometimes to get this done. Now we got really good at doing this, and we could do it a lot faster, and we could cut costs in certain areas. But the problem we ran into, well, not really a problem, it's something we couldn't overcome, is the teeth were still removable. They were clipping on to a removable denture, or clipping onto the substructure. Patients function like this fine, and they're really appreciative of it because it's 100 times better than a regular denture. Patients like this. But now, for the same cost, we can extract the teeth, put the implants in, put the teeth on same day, and the teeth are fixed in the mouth. The teeth do not come out. And so in one day, for the same cost, they've gotten a better prosthetic. Everything's done same day. The night of surgery, they can chew because their teeth are supported by the bone. The teeth are not resting on sore gums that are stitched closed. The teeth are snug and secure on the bone. And patients don't have to come through multiple appointments spread out over a year. It's a much better way to do it. It's less expensive, and it's far more predictable. We plan everything out on the computer. Everything is discussed with the patient. There's a lot of pre-planning. So yeah, you might come in for a few consultations to make sure you know exactly what you're getting. You know the costs, you know the risks. But geez, the day of surgery, it's one day, you go to sleep, you wake up with brand new teeth. So really exciting we're able to offer this to the people of Southern Alberta, and I hope you found this helpful and educational. Have a good day.